Welcome to Mindset Monday. My name is Dr. Ifayo Lele, and this is my beautiful wife, Dr. Chichi.
Thank you for joining us today. Today, we're going to talk about a very important topic that affects a lot of families, and that is postpartum depression. Postpartum depression usually happens in a family to the mother of a child when the mother has just newly given birth. And it's something that not only affects the mom, but it can affect the father or boyfriend, as well as possibly affect the child. So, babe, when patients come to you and they're not sure what's going on, how are you able to find out or figure out that the mom is experiencing postpartum depression?
Yeah, I just look at the basic symptoms that the mother may be struggling with, such as sleep disturbance, problems bonding with her child, agitation or irritability, and problems with concentration and eating. Those are just a few. And so those are the things I look into seeing if this is a postpartum depression case.
Motherhood is so difficult, and before anyone embarks on it, nobody really like teaches you how to be a mother. Nobody teaches you what's gonna happen after you've had the baby. And just in speaking with people that I know who may have experienced this, I mean, it could be something simple as feeling discouraged because their milk supply may not be producing as much as they envisioned that. Could that be also a possibility of what could potentially cause postpartum and maybe just hormonal changes?
Yeah, touching on that, yeah, definitely hormonal changes where the estrogen and progesterone drop from after the pregnancy. Then also too about their identity as a mother, like you get a great example. And when a woman feels inadequate as a mother, that could also build up on her depression that she's experiencing as well.
So, do you think that postpartum depression only happens like for people who are maybe having their first child, or could someone have postpartum? Maybe they didn't have it with their first child, but maybe have it with their second or third child. Could that happen?
It could definitely happen after having your second child, and then that time they're wondering what happened. This didn't happen with my first child. Why am I experiencing it? And this is where it's a struggle for a lot of mothers and even fathers as well, that they're dealing with a new child, new responsibilities, and they might have more children, and that's where it becomes a struggle for them because they have to also factor in working, the housing environment, and all these considering even lack of support. So that's where a postpartum depression plays a big role in the lives of the mother and the father.
So you mentioned about the father, and I think I've heard you just talk about this in the past. Are you saying that fathers can also have postpartum? Is it like called the same thing, or how does that? Or because I've always thought that postpartum was only mothers.
Majority of the cases, it is the mother, but a father can also experience this because fathers also can struggle with mental illness as well, having a past history of depression, but also being the responsibilities of a father where they're supporting their wife, they're supporting a child, and sometimes they don't know how to handle this newfound responsibility, and they may struggle also with sleep disturbance, problems with their appetite, problems with concentration, and more of the depressive symptoms. So fathers are not exempt as well.
Yeah, and one of the things that, to keep in mind, because I know that sometimes when people, maybe mothers who just have a baby and they're kind of feeling down, automatically everyone says like, oh, baby, you must, be having postpartum. But I think there's something also called postpartum blues, that it's not a full-blown postpartum, but it's like similar. Can you elaborate a little bit on that?
So like what you're talking about is the baby blues.
Oh,
So
baby blues.
with the
Okay.
baby blues, that's like few days to about 2 weeks after having the baby. It's not as serious and as intense as the postpartum depression, but they're able to bond with their child, but they do have those feelings of sadness. And another spectrum is postpartum psychosis as
Oh,
well.
wow.
And
What's that?
this is when it occurs when the mother starts having like auditory and visual hallucinations and paranoia and even thoughts of harming their child. And that could also occur in postpartum depression, having the thoughts of harming your child. So it's very serious, and that's where it's important for family members and even healthcare providers treating the mothers to ask and screen for these questions.
You know, I really agree with everything that you've just said. And it's just so unfortunate that, like speaking as a mother, like after having a child, you have the wellness visit for the baby. But I think there's only like one wellness check for the mom, and, being a mother is a very challenging, rewarding experience. And I just think that we really need to, keep an eye on our mothers, check in if you've got friends, family members that just, recently had babies, just checking on them, make sure they're okay, provide that support. I do have one more question though. So if someone is experiencing postpartum depression, how long would they typically experience it for? Is it for like the first year of the child's birth? Or could it last for like 7 years? Or how long would somebody experience postpartum for?
It varies case by case, but that's why it's very important for the mother to have regular checkups with their OB, and even checkups with a mental health provider.
Okay.
So that way they're able to control the symptoms, and they may need to be placed on medication. And if they choose not to do medication, therapy is another great way to handle it, because that way you get to speak with a therapist and talk about your problems, and the therapist will be able to guide you and give you a great treatment plan to handle this new symptoms that you're experiencing, but also being a mother. So including the OB-GYN, your family medicine provider, your mental health provider, and your pediatrician, your kid, that is a great team of providers to know what's going on.
And I found this information very helpful. Thank you so much for joining us. If you'd like to hear more, please follow us at our social media handle, Twitter, Instagram, Facebook at GPSMindset. And don't forget to subscribe to our YouTube channel at GPSMindset. Thank you. Have a great day. Bye-bye.